Hello everybody and welcome back to my channel. This is Dr. Mridula V. Amarnath here. So now that you're pregnant, there are a couple of things that you will have to alter and modify. And some of those most important things are your lifestyle changes, your diet, the way you eat, what you eat, how much you eat, your exercise, your sleep, the medications that you take, all play a very crucial role from now onwards, because whatever you eat also has an impact on the baby. So I'm sure you're not the type who would have had no alcohol, no smoking, no junk food, no medications at all, who takes vitamin tablets, who does exercises regularly. Are you that kind? Well, if you are that kind, then a big round of applause to you, because then you're already in the right track. But if you're not, then now is the time. You really have to make an effort, plan everything accordingly. Things that you should eat, which is safe for you during pregnancy, things which you must avoid while you're pregnant, and the exercises which you will have to do. So stay tuned. Well, I know you have the small little question creeping up in your mind that I didn't know I was going to be pregnant, and hence I had taken a couple of drinks, or I smoked, or I had certain kind of medications. Well, that's okay. I mean, it's not okay, but you should certainly inform your doctor about it, because then she would be extra cautious while doing your tests and would immediately do an ultrasound to rule out if there is any miscarriage or if the fetus embryo is absolutely fine. So studies have shown that consumption of alcohol, tobacco and certain medications can have a devastating effect on your baby. Okay, what we call as an all or a none phenomenon. Okay, sometimes a none phenomenon, which means that the toxins can actually enter into your fetus and can completely destroy the fetus and can eventually result in a miscarriage. Especially it is more harmful during the first few days of your pregnancy. While for some, what we call as the all phenomenon, where they're really lucky, that is the embryo hasn't established a full blood connection with your blood. Okay, so as a result, it doesn't harm the fetus immediately. But let me tell you, you have to be extra cautious hereafter. Make sure you do not consume anything toxic, which is going to really harm your little one. So I'm going to talk to you about how each one of this can have an impact on our little one. Now, say for example, smoking. Smoking can cause the following complications. It can cause low birth weight, preterm birth, vaginal bleeding, and even placental abruption. That is, the placenta separates from the uterus. So let me just quote this one incident. Okay, so I had this one patient who had come to me. She was a pretty young lady. So she said, "Doctor, I'm going to find it very difficult to quit smoking, and I am pregnant. I am 1 month pregnant." So I said, "No, that is not good. You're going to have a tough time and it is not good for the baby at all. You surely have to stop smoking." But she was like, "No, doctor, I find it very hard because I've been doing this for so many years, and suddenly if you ask me to quit, I cannot. But then I've also read that, smoking would give you a low birth weight baby." So I was thinking about it and I thought it was absolutely fine, because probably if I have a baby who is of low birth weight and small in size, my pregnancy would be really, painless. I was shocked. This is what you call complete ignorance. Half-read knowledge. She just said smoking would give you a small baby or a low birth weight baby, and that is complete ignorance. That is not true. Smoking basically causes something which is called as intrauterine growth retardation, where it completely affects the growth of the baby. Even in future, it completely affects the baby's blood supply. So the baby's head will grow as per its age, but the entire body won't grow. So there will be a complete disproportionate in the entire body of the child, and this is not correct. So you must make a conscious effort, because it's for your baby. It's something that you wanted it, right? So it's for your baby. So you must make a conscious effort to completely quit smoking. Even alcohol can cause the following complications, like it can cause a decrease in the heart rate for you as well as for the baby, something which is called as the fetal alcohol syndrome. mental retardation, and various physical abnormalities. I would certainly recommend that during this pregnancy period, completely stay away from alcohol, because each person's body reacts in a different way, and there is no particular measurement that so much of alcohol or beyond this can cause fetal alcohol syndrome. No, there's nothing of that sort. So it is important that you completely restrain yourself from alcohol during this pregnancy journey. Even certain drugs can cause problems like vaginal bleeding, placental abruption, preterm birth, low birth weight, major birth defects, drug dependency in the baby, where the baby eventually starts becoming very irritable, crying baby, and even fetal death. So it is important, if you're having certain medications, that you consult your doctor, because certain medications are absolutely safe that can be taken during pregnancy, while certain medications cannot be taken. So instead of that, there are certain alternative medications that can be taken, which are safe for pregnancy. So it is important that you consult your doctor and tell your doctor, these are the list of medications which I'm taking. Can I continue them? Should I stop them? Or is there an alternative?